Good evening from New York. I'm Chris Hayes. We are in the midst of a global pandemic. That's been evident probably for weeks now, but today the World Health Organization officially declared coronavirus a pandemic because of the widespread scale of the outbreak. The WHO has been working on this virus from the beginning when it first broke out in Wuhan, China. They saw how it took down an entire city's healthcare system and resulted in over 3,000 deaths in China. WHO has been warning about coronavirus for months, but they have been reluctant to make the pandemic declaration for fears of inciting panic. Until today, when they decided that now is the time.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
Alarming levels of inaction. That message there, similar to that of Dr. Anthony Fauci, a guy who's run the National Institute of Allergy and Infectious Diseases since 1984. He's worked under 6 presidents, played a major pivotal role in reining in the AIDS crisis. Today, he testified before the House Oversight Committee, and he was forthright and he was honest about what is coming at us right now, unlike the president.
Is the worst yet to come, Dr. Fauci?
Yes, it is.
Is there any chance we will have a vaccine in a few months?
No, I made myself clear in my statement. This is a really serious problem that we have to take seriously. I mean, people always say, well, the flu does this, the flu does that. The flu has a mortality of 0.1%. Sure. This has a mortality of 10 times that. We would hope that as we get to warmer weather, it would go down. But we can't proceed under that assumption. We've got to assume that it's going to get worse and worse and worse.
Dr. Fauci's testimony today was almost literally the exact opposite of what President Trump and members of his administration have been telling us for weeks and weeks. We finally got to hear a candid version of the truth from a genuine expert, unedited. Here is where things stand right now. This exponential curve shows the growth of coronavirus cases outside of China. Right now, there are nearly 45,000 confirmed cases in the world outside of China, where the outbreak appears to be under control. This is what the U.S. curve looks like. Almost identical, right? Looks a lot like the global curve we just saw. In the U.S., 4 weeks ago, we had 15 cases. Just over a week ago, we had 100 cases. Today, we have over 1,200 cases. That number probably does not even capture the reality because our testing capacity is not actually measuring the scope of the problem. What is clear is we are racing up this exponential curve at an almost similar rate to the countries that have gone before us. For instance, Italy. Italy right now is in the midst of a full-blown public health crisis. The country is completely on lockdown. Today, a new measure announced. Italy announced it will stop almost all commercial activity aside from supermarkets and pharmacies. Think about that for a second. Everything closed except for drugstores and food. Italy also announced today they now have over 12,000 cases, and the total deaths in the country have increased, listen to this, have increased over 30% in just 24 hours, from 631 to 827. 30% increase in fatalities in one day. This chart shows the rapid growth of cases in Italy. Does that look familiar? It should. You can also see how the U.S. is right now following almost the exact same trajectory, just a week behind. Now, many, if not most, of those deaths in Italy are likely a direct result of what we have already seen with this virus in Wuhan, China. The virus is overrunning the healthcare system capacity. Anywhere in the world, at any given time, in any given city, there is a fixed amount of doctors, ICUs, beds, ventilators. The systemic risk the virus poses to everyone around the world right now, including in the U.S., is what is happening now in Italy. Doctors in that country are intubating patients in hallways. Massive numbers of healthcare workers are infected. They are having to make wartime triage decisions about who they can afford to treat. The Atlantic reports on a remarkable document issued by an Italian medical college that recommends doctors allocate their stretched resources to patients with the highest chance of recovery. Italian doctors are being forced to decide who to save and who to let die. Tom Bossert, Trump's former Homeland Security advisor, told NBC News yesterday that we are 10 days away from the hospitals getting creamed. We are now 9 days away. That is where we are headed right now in this country. The only thing we can do at this point as citizens, as civil society, because the testing has been screwed up inexcusably by the federal government, is to take dramatic steps collectively to socially distance ourselves, to try and flatten the curve of this epidemic and slow the transmission of the virus in order to stop a run on our hospitals, to protect vulnerable populations in our midst. That's older people, people with serious chronic medical conditions like heart disease, lung disease, and diabetes. We all have people in our lives that are vulnerable to this. And the clear steps to take are canceling large-scale events and reducing travel, reducing going out, even going to restaurants or events. We need to take this all deadly seriously. You can go read the warnings from Italians who said we did not take this seriously enough, and now we are in it. That's their message to us. That message, however, is not being adequately communicated at all by the most powerful person in the country. Someone we'll be hearing from later tonight, a man who insists on propagating disinformation and meeting with CEOs to discuss an economic problem. But the right message is being communicated by people in administration like Dr. Fauci, by former Trump administration officials like Tom Bossert and former FDA chief Scott Gottlieb, by governors like Washington's Jay Inslee, who today announced they are shutting down events over 250 people. The reality is we have to take dramatic steps. And we are only now at this late hour starting to see those steps in action.